meeting. Please feel free to indicate who will be doing the presentation and also introduce the DG and the team. Thank you.
Okay, thank you very much, Honorable Chair, and good morning to all the members of the Portfolio Committee. I am joined by the Director General, Dr. Buthelezi, who will then delegate to another senior official to make a presentation. We are really delighted to have been invited to make this presentation to the committee, a treaty for the establishment of African Medicines Agency called in abbreviation AMA. This idea, Honorable Chair, predates the COVID-19 pandemic. Member states of the AU had started this process. Now, when you look at it, is over a decade, of course, partnered with WHO. Among other reasons and objectives is that when you look into the whole of Africa continent, we are the biggest consumers or the users of malaria products. Up to 90% of malaria in the world is in Africa. We are also the biggest consumer of HIV products. Almost close to 60% of the countries in Africa use or are actually in need of ARVs. Can we therefore assume that we have medicines that are safe, efficacious, and good quality as a continent now, not just one country? Can we have regulatory systems in place of these products to avoid a circulation of substandard medicinal products that may do harm to our citizens of Africa? Now, this is a desire, therefore, of the continent to create institutional, scientific, and regulatory resources to improve access to safe, efficacious, and quality medicines. So we have had this program in the cabinet, and cabinet signed this treaty. But according to our constitution, as it will show in the presentation, the ratification of such a treaty needs parliament, and it needs the honorable members who are logged in here to maybe look at it, listen to us on their own time, discuss it, and maybe if it is found to be worth supporting, then ratify it, and therefore we take the process forward. So the main presentation, Chairperson, today is to get the leadership here to note the progress that we have made as a country on this process, and to request your considered discussion and approval of this treaty, because many countries in Africa look up to us as a strong country on regulatory processes, and therefore they would like to tap on our knowledge. Right now, we are not able to give any strong support as a full member, but they already are tapping on our resources. Maybe then I will ask DG to delegate an official who's going to take us through the formal presentation. Thank you very much, Chairperson.
Thank you. Before you do, Dr. Lomo, I still have some work to do before I hand over for the presentation. Honorable members, just to remind you that this is a meeting. This virtual meeting is deemed to be in the precinct of Parliament, therefore constitutes a meeting of a committee of the National Assembly for official purposes only. In addition to the rules of virtual sittings, the rules of the National Assembly, including the rules of debate, apply. Members enjoy the same powers and privileges that apply in a sitting of the National Assembly. Members should equally note that anything said in the platform is deemed to have been said to the House and may be ruled upon. All members who have logged in shall be considered to be present and are requested to mute their microphones and only unmute when recognized to speak. This is because the microphones are very sensitive and will pick up noise which might disturb the attention of other members. When recognized to speak, please unmute your microphone and connect your video. Members may make use of the icons on the bar at the bottom of their screens, which has an option that allows a member to put up his or her hand to raise points of order. The Secretariat will assist in alerting the chairperson to members requesting to speak. When using the virtual system, members are urged to refrain or desist from unnecessary points of order or interjection. As you've heard the Deputy Minister say, we're going to receive a presentation on the African Medicines Agency Treaty, which had been ATC'd on the 14th of February 2023. And so this is incumbent upon us, honorable members, to ensure that we follow the process of this treaty that has been forwarded to us as the Portfolio Committee on Health. First is to receive the presentation, to have discussions, to then have a report drafted by our support team and then adopted by the committee in a special meeting. And then obviously it goes to the House for adoption and then to the National Council of Provinces for their discussion and concurrence. So with that having been said, over to you, DG, since the DM had already indicated that you will be taking the presentation forward and whomever you would be tasking to do that work. Thank you.
Thank you very much, Honorable Chair, Honorable Members, Deputy Minister, and all the colleagues present. Before I hand over to Dr. Motisenyane, I just want to indicate that the team that is going to be supporting the Deputy Minister is, we've got myself, Dr. Aquina Tulare, Ms. Tsakane Mnisi, and Dr. Motisenyane from IHL, and Advocate Moabelo from our legal unit. I therefore would like to introduce Dr. Moketsi Motisenyane from our International Health Liaison responsible for Africa to actually lead us through the presentation. Thank you very much, Chair.
Thank you very much, DG. Thank you very much, DM and honorable ministers, honorable members. Can I ask Mr. Khatla to fly the presentation? Can you put it on? Thank you very much. This is the presentation really around the ratification of AMA. I'm going to present, next slide. Purpose of the presentation, strategic importance of AMA, the background to the establishments of AMA, the value proposition of AMA for South Africa, South African process for the signing and ratification of the treaty. And then I'll just briefly provide vision and mission of AMA, its objectives, key functions, the organs of AMA, the financial resources, and what we are recommending. The purpose of this presentation is to request Parliament to take note of the process undertaken by Department of Health to finalize the process for the ratification of the treaty for the establishment of AMA. Secondly, to request Parliament to support and approve ratification of the treaty for the establishment of AMA as contemplated in section 231, subsection 2 of the Constitution. So what is the compelling requirement for us, for Africa to have a medicines agency? With 17% of the world's population, Africa bears disproportionate burden of disease. We account for a quarter of world burden of disease, 60% of people living with HIV in Africa, 90% of the world's annual malaria cases are found in Africa, only 6% of the world's health care spending, and less than 1% of the pharmaceutical market. The continent produces only 3% of the medicines it consumed by its own people, but also we have high prevalence of substandard and falsified medicines. This is because of the fact that we have insufficient access to quality, safe, effective, affordable medicine product, which is largely attributed to weak or even absent medicines regulatory system in other member states, and the fact that many of the national and regional economic communities have different procedures and systems for regulating as well as providing medical products. Next slide. So the establishment of AMA was first discussed by the meeting of the African ministers, which was held together with World Health Organization in Angola in 2014. The focus was to prioritize investment in Africa for regulatory capacity development and to pursue efforts towards convergence and harmonization of medicines regulations at the level of regional economic communities. We are part of SADC. A task team was established to develop modalities for operationalization of AMA and development of treaty, amongst others. Next slide. Following the finalization of key documents of AMA, including the treaty itself, this was done through a consultative meeting, which actually started in Midrand in South Africa. And the treaty was then finalized and adopted by the African Union Ministers of Health at their working group meetings during their second specialized technical committee on health, population and drug control, which was held in Geneva, Switzerland in 2018. Then the treaty, as per AU procedure, was then approved by the AU Specialized Committee on Justice and Legal Affairs on November 2018. Subsequent to that, the treaty was adopted by the AU heads of states and government during their 32nd ordinary session in February 2019 in Ethiopia. And to this effect, the AMA has entered into force on 5th November 2021 after the 5th instrument of ratification was received by the African Union Commission. To this end, you see on this slide that we have now, as on 11 October 2022, 20 African countries, member states who have ratified and deposited the AMA Treaty. The 3 of them have ratified, but not yet deposited the treaty with the African Union Commission. 10 of them, they have signed, but not ratified, and 22, they have not signed. Next slide. So because the treaty now is in force, the first conference of state parties of AMA Treaty was held in Addis in June last year. And during that meeting, they discussed a number of issues of procedure for AMA, including the hosting of headquarters of AMA, and for that effect, Rwanda has been selected to host the AMA during their meeting, during the Executive Council meeting of the African Union. Dr. Sidibe has also been identified as a special envoy for AMA, who has actually moved to a number of countries to request countries to ratify the treaty. Other administrative activities like the appointments of the Secretariat, the DG and so forth, and its structures, is work in progress as indicated, and it will be finalized soon. So what is the value proposition for South Africa for in terms of the Medicines Regulatory Agency? You might realize that globalization has meant that regulatory of medicines is no longer purely a national responsibility. There's a need for South Africa and indeed African countries to reduce the prevalence of substandard and falsified medicines and vaccines in the continent, and also the fact that for the first time, South Africa will have a consistent voice on regulatory issues, pulling expertise across the continent, again, making sure that there's regulatory harmonization, convergence, such as standards, guidelines on the quality, safety, and efficacy of medicines, but also it will also assist us in terms of implementation of the Africa Free Trade Continental Agreement, which has anchored pharmaceutical initiative around local production of pharmaceuticals, good procurement issues that is currently being discussed, harmonization of regulatory and quality frameworks. Then the other thing is that the harmonization initiative is the most cost-effective in the sense that there's a speed in terms of access of essential medicines, and we ensure that there's efficient use of resources through work sharing among national and regional medicines regulations. Next slide. So, strategic importance again of AMA South Africa is actually in line with South African global and continental commitments as reflected in the Sustainable Development Goals, the Universal Health Coverage Agenda, the Africa Vision of 2063, the SADC 2063, that all talks about access to affordable, high-quality medicines to be healthy and productive through the life course. Again, the AMA is aligned to South African policy imperatives as reflected on priority number 2 and 4 of the National Development Plan, the medium-term strategic framework that talks about creating a conducive environment that enabled national priority sectors to support industrialization and localization, leading to increased exports and employment of South African products within the continent, implementation of Africa Free Continental Free Trade Agreement and other trade agreements to grow intra-Africa trade. It contributes to the implementation of the Agenda 2063 flagship project, which one of the flagship projects talks about local production of pharmaceuticals in the African continent. And it talks about also efficient procurement of systems to increase access to medicine, and also effective regulations and quality control of medicines and medical devices to promote and protect public health in the continent. The process for signing and ratification of the AMA in South Africa started with the presentation of the cabinet memo, which was presented to the ICTS cluster. And then after the approval, it was then sent to cabinet, and the cabinet was presented and approved by cabinet. We have two legal opinions that we have received from the Office of the Chief State Law Advisor and the State Law Advisor from Justice, where they also indicate that upon the cabinet signing the treaty, that the treaty must be tabled in Parliament with a clear indication that it is tabled in terms of Section 231, subsection 2 of the Constitution. However, they've also indicated that South Africa, after it has actually ratified the treaty, we must put a reservation with respect to the applications of Article 8 as preferred in the legal opinion. And that Article 8 talks about immunities and privileges. So what is the vision and the mission for AMA? The vision statement says is to ensure that both locally produced and imported medical products for priority disease and condition in Africa are affordable and meet internationally recognized standards of quality, safety, efficacy. The mission statement is to coordinate national and regional medicines regulatory system, in the case of South Africa, SAHPRA, to carry out regulatory oversight of selected medical products to promote cooperation, harmonization, and mutual recognitions on regulatory decisions among regulatory bodies. The objectives of AMA are to coordinate and strengthen ongoing activities to harmonize medicines regulations, promote cooperations, mutual recognition of regulatory decisions, carry out oversight, and then also to pool the expertise and capacity and strengthen network for optimal use of the resources. These are the AMA functions, and also these are the focus areas. I need to also indicate to the honorable members here that AMA will not replace regional economic communities nor national medicines regulatory authorities. SAHPRA will still do its function. The functions of AMA is around market authorization, joint inspections, market surveillance, conducting oversight on the clinical trials that are happening in the continent, monitoring safety and quality controls. The four focus areas that in the first 5 years that AMA will focus on will be around policy alignment and regulatory reforms, regional integration and harmonization, human and institutional capacity development, and coordination partnership. And I need to indicate that South Africa, through SAHPRA, is already supporting a number of countries within the SADC region and also in the continent, given the capacity that SAHPRA has. In terms of the organs of AMA, AMA has the following organs: the Conference of Parties. These are the member states of the African Union who have signed and deposited, who has ratified and deposited the treaty. And currently there are about 20. And then after that, there will be a governing board. The governing board is not yet established, and the secretariat and clinical committee. Hence, it's very important for South Africa to participate in the board and also in the secretariat to make sure that we advance our own national interests. In terms of financial resources, AMA would receive the sources of AMA as per the discussions will be around member states' contribution, industry fees, and the money from the partners. However, The money from the partners will also make sure that as AMA receive the grants and donation and proceeds from its activities, there are no conflict of interest from the private sector. As a recommendation, we are requesting Parliament to take note of the process undertaken to finalize the process for ratification of the treaty for the establishment of AMA in South Africa, but also to ask Parliament to approve the ratification of the treaty for the establishment of AMA as contemplated in section 231 subsection 2 of the Constitution of the Republic of South Africa. I thank you, DG.
Thank you very much, Dr. Motisenyane. I will hand over to the Deputy Minister.
Honorable Chair, that is what we are presenting to the Portfolio Committee, mainly requesting your noting of the progress we have made, and also through, after your discussions, deliberations, approve this treaty as actually expected from the constitution of our country before we can then take it and say we are a full member of this body. We really request that look, we have heard from the presentation how much already other countries are making use of our resources in the form of SAPRA because of the strong regulatory programs they rely on very much, and therefore they feel a bit sometimes lost without us being part of a full member there. So we are presenting it to you, honorable members, for your consideration. Maybe we'll then wait for now for clarity-seeking questions and your comments and guidance, Chairperson. Back to you now. Thank you.
Thank you very much for the presentation. Thank you, DM, for leading this. We would obviously note the progress you've made. We are hoping to approve this treaty soon. I've already explained the process that we will follow, honorable members. So now it's up to us for discussions and deliberations. I will take the hands of Honorable Gela Wilson in that order so far. Any other hands? Chirwa? In that order, honorable members, Gela Wilson.
Thank you very much, Chairperson, for the opportunity. A very good morning to honorable members and the department. Chairperson, I rise to welcome the presentation and also to support it. South Africa is an economic hub, and also, Chairperson, we must participate as South Africa. And I'm glad that the role of SAPRA is being clarified by the presenter. And also, Chairperson, one question, just Chair, in terms of slide, is it 10? The slide that talk about financial resources. Maybe if the department can just indicate to us, Chairperson, in terms of contribution, maybe the fee. I know in some instances, normally there'll be a fee that we pay as a country or as a participant. If I can just get the clarity on that one, Chairperson. But also my second question, Chair, it's regarding the countries. I hear that 20 countries from Africa are participating, but I just want to check even abroad, Chairperson, the Western countries, if I can just get a sense of whether they are also part in this AMA, Chairperson. But so far, Chairperson, I rise as African National Congress to support the AMA treat, Chairperson, with those questions, Chairperson, that I've just raised. And thank you very much, Chairperson, for this portfolio committee meeting so that we get understanding and we are not being left behind as South Africa in terms of participating in this entity. Thank you very much, Chair.
Honorable Wilson.
Thank you very much, Chairperson. So I have a few questions, and I hope that you will be able to assist me. First of all, how much is the membership to the AMA, and from which budget will it come? And is it retroactive? You know, everything that we do comes with a budget, and whose budget will this come out of? Will it come out of the Department of Health's budget in South Africa? Exactly how will this be done? Obviously, that's a huge issue given the current state of health as it is at the moment. I want to know, does each member state pay an equal amount? And if not, how are those contributions determined? How will the AMA membership impact the health entities and their long-term goals and budgets? Obviously, this is all now being determined by these costs that I'm discussing. How will the, please explain Article 8 in respect to privileges and immunities set out in the General Convention of the Privileges and Immunities of the OAU and the additional protocol to the OAU General Convention on Privileges and Immunities. My concern there is, does this mean that possible corruption will not be investigated? We sit with a lot of corruption in health at the moment, and it's been particularly bad, and we must make sure that any such corruption by any such thing that we tie our names to is properly investigated. Is the member states' annual performance monitored, and does failure to reach targets impact on our memberships in any way? Can you quantify the real value that South Africa will earn from ratifying this treaty? Will the AMA have an ability to enforce punitive measures when necessary on sovereign jurisdictions? If yes, can you please explain to me how that's going to work? And will SA be able, or South Africa be able to opt out under certain conditions? To what extent is our sovereignty honored? Thank you, Chairperson.
Thank you.
Thank you. Greetings to everybody that's present in the meeting. I have a few questions as well. I want to find out, because I think it's an ongoing thing and keeps happening where, you know, as African countries and South Africa in particular, we have put the FDA as the standard, you know, and I really want to know, why is the FDA considered the standard, especially in relation to our aspirations of building capacity? Why are they always tied to relations with the WHO and the FDA? Is there no possibility, according to the government of the day, of achieving capacity building of the public sector without always perceiving the WHO and FDA as the primary standard of measuring our capacity aspirations, of measuring our goals, of measuring the direction we should be heading to, taking into cognizance our domestic needs, our domestic attributes, our domestic challenges as well. Especially as the government of the day, I need to know what this obsession with the WHO and the FDA is and where it stems from, because it's like the bedrock, or the bedrock of our healthcare system. And it's not even like because you reach those standards, you don't reach them either way. And secondly, on Article 8 as well, you know, because it means we all share concern of the issue of corruption. We know our African countries, we know majority of their governments, we know the South African governments. you know, all of us in this room. And I'm happy that even the department has a reservation on or in relation to Article 8. I want to know what the reservation of the department is in relation to Article 8. As a department that is always soiled in issues of corruption, you know, that has seen the healthcare of our people not being catered for, with the amount of litigation cases we have, like all those issues that we have. I'm interested in knowing what your reservations are about Article 8, that raises a concern about corruption and how punitive measures will be implemented. And I also want to know that if there's an assumption that corruption will not be investigated in accordance to Article 8, or if that corruption will be investigated, I want to know what body will then have the authority to do so according to what the treaty is proposing. And I also want to ask about the fact that indigenous medicines are being overlooked. These are African countries. This is the AU, this is the AMA, but indigenous medicines are overlooked. I want to know why that is the reason and what will be the intervention to resolve this. And I want to find out also, how does being signatories to this treaty, and I think I mentioned it even before, affect the domestic building of capacity of our public sector in relation to a state-owned pharmaceutical company that is functional. And second to that, the impact on the NHI, which is currently in its format, the outsourcing of the public healthcare to the private sector in majority, because the two-tier system is still withheld. You'll just be paying invoices from the NHI fund to the private sector if there's persons who are accessing those facilities. I want to know how that affects our aspirations, or rather the desire to build internal capacity of the public sector when the requirements of participating with the private sector under its current system will require a lot of money. And I think we've raised those things, as the private sector has no integrity of prioritizing our healthcare over its profiteering system. Those are things that the government knows about the private sector. And lastly, I want to find out which other entities besides SAPRA are involved in their capacity as regulators. And also, second to that, how do we get surety of their independence? Because we don't have authority or jurisdiction of oversight over those regulators, as this is the issue that we've had even with SAPRA. For example, we've made an assertion that, you know, it's captured by Bill Gates, and we saw how that resulted in a duopoly in vaccine procurement by the government during the COVID pandemic, and different standards for Western vaccines as opposed to vaccines from China and Russia, with the whole Pfizer debacle that SAPRA still hasn't answered. The government still hasn't answered. The other time, the minister gave a very vague response on what they did when those reports about Pfizer came out, and he said they didn't do anything because Pfizer didn't reach out to them. You know, so things like that. Who will have the oversight and accountability responsibility of the treaty, of the entities that are involved? Because we do not trust SAPRA, we do not trust the NDOH, and we don't necessarily have jurisdiction of doing oversight of other African entities, some of which are also functioning under corrupt governments like the ANC in South Africa. So please appraise us on that particular aspect. Thank you.
Honorable Dlamini, followed by Honorable Kaba.
Thank you very much, our chairperson. And I hope I'm still audible that side, because load shedding has just hit here. And
You
in
are,
relation
Honorable
with
Dlamini.
thank you
You
very
are,
much.
sorry.
Thanks. The questions have been raised, and I'm sure we all are talking to support the work that is being presented here by the department, which I want to start with to say a support through the presentation that has been done on ARMA, but to mention that the points or questions that are being raised are very, very important and would require a range of responses, but also work to be done so that the treaty is able to fit in the desires of our societies in Africa, and particularly in South Africa and the region. I'm sure my sister from the EFF have mentioned the NHI, which is a policy direction that has been adopted to finalize, which should enable even a non-paid person to access health facilities and medication in particular with this point. And I would want to believe that the department is working hard to ensure that the access will be possible even for the least paid or non-paid person. When they are sick, they cannot be prevented from accessing services because they don't have money. So, but lastly, I want to say what I've said in the beginning, that we support the department on the work that is happening so that we have this ARMA, the treaty in the way that we want to see. I thank you very much, Chair.
Thank you, Honorable Kaba. Followed by Honorable Dr. Susan Tembakwayo.
Thanks, Chair. Chair, I think let me rise to support Honorable Stumo Dlamini upon the good work that the department is doing, and that the ARMA indeed be adopted and approved by the portfolio. This I'm raising also in support of Honorable Geller, but also, Chair, to indicate that my view and proposal of their portfolio to really adopt and approve ARMA is based upon the following: that, you know, as the portfolio committee recently, we had an official by Mr. Khatla also advising us, even Dr. Aquine Tulara advising us of a possible coming of the ARMA conference and SABAC conference in June, wherein I may request them to indicate the dates and clarify, inviting the portfolio committee. We are so excited of this. It indicates our continuity of African work, our continuity of ensuring that South Africa is placed where it is supposed to be, in leading Africa on many avenues, including the medical sector. And we are also saying, Chair, we are impressed by the utilization of other countries with regard to SAPRA from the presentation, as we may have heard. This is very much encouraging. This is positive for the people of South Africa and us as well. And also, Chair, to indicate that indeed, from the presentation we have heard that there had been this proposal was indeed discussed also earlier by the executive, wherein the state law advisor and the parliamentary legal services had the input around to say this must come to parliament, of which is our responsibility. And in coming to parliament, we may raise a particular amendments around the section 8 that is being quoted here, article 8 that is being referred here, because we are a progressive and a concerned and a clean government with regard to anywhere else in the world. So this had opportunity of reflection of the key structures in parliament that are attending to this. And we can't be delayed and we can't be late in leading in Africa and showing our capacity and skills around medicine. That's why we are commending the department of this. Moreover, Chair, we are also excited by the fact that we'll be learning from also the presentation in terms of the work of AMA. It was articulated that also here they also share best practices in Africa. We are not the best. People may be sick all over the world, but then through this, having approved this AMA treaty, it indicates our readiness and to say, you know, Africa for the Africans, and then we'll also be learning on those things. So, Chair, I think we are ready, and as portfolio, I would lobby that we proceed and present it to Parliament, and this be approved, Chair. With having said that, Chair, with the questions having raised, will be clarified on them. I rise to support Honorable Keller and Honorable. Thank you, Chair.
Honorable Jim Bugwaya.
Thank you, Chairperson, and thanks for the presentation that was done now. I just have one question here pertaining to the aspect of an agent and compelling requirement for, as it is mentioned, it was in the presentation, to say how would they be able to make sure that efficacious and affordable of medicinal products is processed and it's maintained. Thank you.
Thank you. Any other members? Deputy Minister and DG from myself. Thank you very much, firstly, for the presentation. We welcome it. We also welcome the fact that so much work has gone into getting yourselves to participate in this treaty of the African Medicines Agency. We understand the importance for Africa to be able to manufacture its own medicines and other needs for the health sector. We also understand that South Africa does have a huge role to play in many of these structures in order to advance the health of all people of Africa. So recognizing then what you were saying in terms of the efforts of on cooperation between the economic communities of Central Africa states, other states, our region itself, the particular diseases which plague our region, for example, malaria, HIV, AIDS, and the percentages which are mentioned that South Africa itself represents 60% of all HIV, AIDS positive patients. Or let me say HIV positive patients on the African continent. And therefore, of course, it makes it a necessity for us to be able to participate in such a regulatory framework, but hopefully it's not only a regulatory framework, but it's also an opportunity be able to advance the countries in terms of, as I mentioned, manufacture, and also trade, of course, amongst each other, but also, as we said, standardization of the pharmaceutical drugs and the devices, medical devices and equipment, which are needed to perform the work of enhancing the health of our people. Now, this might be a bit of a difficult question that I'm going to ask, but possibly it is not. Now we know that when companies want to introduce either pharmaceutical drugs or medical devices or equipment, etc., to the South African market, whether it's in the public health space or in the private health space, then they have to, there's an agreement that SAHPRA has in terms of its regulations that clinical trials or approvals, clinical trials which had been peer reviewed and published in the proper journals and had been accepted as good clinical trials, meaning it's a gold standard for acknowledgement of whether that it's a drug or device, etc. But of course, that gold standard then being applied and used in terms of accreditation either by the CE or the FDA, and also in terms of the ISO, International Organization for Standardization. I've heard that there's something new called NDR, and I'm not talking about multi-drug resistant TB. I'm talking here about something that I don't really have a good understanding of, which might be a new standardization process being utilized, I think, by SAHPRA and other health regulators. If you have any knowledge of that, maybe to explain that in context of this AMA treaty, and how that will really affect ourselves as South Africa, and also how that will affect the operationalization of this board or this unit, probably called a unit or a board. There is a word, I can actually look for that word, or the organization, which will be formed by the countries which participate or which are signatories to the AMA treaty. Hopefully be able to answer that question for me. Thank you. All right, honorable members, I saw the hand of Honorable Wilson. I see it's subsequently been lowered. So I will hand back to the Deputy Minister and to the DG for replies to the issues and concerns and questions which were raised. Thank you.
Okay. No, thank you very much, Honorable Chair. I will ask the DG to come after me and deal with the questions that might be difficult and technical for me, especially those that were asked by Honorable Wilson. How much, how long, what is the member states' size in relation to the contribution they make? That part I may not be very familiar with. I'll start with the question of Honorable Dr. Thembekwayo, that maybe, Dr. Thembekwayo, this is an opportunity for us as Africa to showcase our capacity of our own researchers, and therefore say the efficacy and the safety, the quality of those medicinal products will now be written up by our researchers in Africa, because we do have, rather than to say, yes, it is only going to be FDA that does this than the other. And then it takes me to also what Honorable Chirwa was asking, very much closer to what Honorable Xaba was raising, to say, isn't it a time now to showcase our readiness as Africa to be able to produce and really have world standard medicinal products that have gone through those trials. The issue, Honorable Chirwa, it might be FDA is coming in to say, we came first, we know better, come and benchmark with us. With this establishment, we are going to be saying, no, we are now on we are on an equal footing. What we do, you also can do. We can only confer, but we are not the world standard anymore. All of you by yourself, we have established and we are there. So I think this is an idea as Africa to move towards that and showcase what we also potentially do have as a continent. Just on this part, there is already a readiness, and you probably might know that the COVID-19 is probably one of those lessons that Africa was at the back foot of everybody receiving this, that, and the other. So next time around, we have another pandemic, we should be able to say, no, at our backyard, we also do manufacture this, that, and the other. So we are not going to be at the back of the queue, and we have already gone the way of establishing our pharmaceutical company in the country, in the continent. That one is actually mainly a responsibility of a Department of Science and Innovation. We would be beneficiaries as health to buy products that have been, so I know there is some work that is going on there, and we hope that one day it will actually, I mean, the lessons of the past must actually make sure Africa accelerates its programs that makes us to be prioritized as ourselves. Because if nobody prioritizes us, then we should not complain if we are in the next round not being prioritized and we have a space now. So I think this is an opportunity to really put our heads together and move quite faster as Africa in terms of being able to stand at an equal footing with any other regulatory authority in the world and say, this is our strength, this is what we have achieved, this is what we are doing with our own researchers. Maybe DG, and thanks for the members who have already indicated their willingness to support this process going forward. But let me give it to the DG to complete the other questions that were probably a bit technical and that it can do better. And Dr. Motisenyane, thank you very much. Over to you, DG.
Thank you very much, Deputy Minister, and thank you very much to the Chair and all the honorable members for the questions. Firstly, before I hand over to Dr. Motisenyane, I think I just want to say that the AMA, as much as it was put into force after the 15th instrument was deposited, it's still in its formative phase. The Conference of Parties is still, which is Conference of Parties. Of course, we don't participate because we have not yet ratified as a country, but the 20 countries that have ratified and have deposited the ratification instrument are forming part of that. So there are still a lot of deliberations on how the board will be structured, how the secretariat will be structured. The only decision that is already made is that Rwanda will be hosting the AMA once it is fully functional. So those processes are in discussion. And the longer we take as a country to do the ratification, a lot of decisions will be made without our contribution, yet they are highly dependent on the expertise at SAPRA in South Africa to do all of this work. Now, quickly, just to touch on, I hope the MDR, not the multi-drug resistant TB, the MDR that probably the chair is referring to is something that is called the medical device reporting, which is really a post-market surveillance tool that is used by the FDA. So what they do is that once they've approved a device for use, they then what they will call post-market surveillance, where they look at potential device-related safety issues and just assess if the device is doing the good that was presented when they were approving it. We've not yet introduced that in South Africa, but I'm sure as we move forward, we will be using it. But it's used is used mainly at the FDA level, and they get these reports every year on how a particular health device that they actually approved is performing in the field. Are there side effects, and can it be improved? If those side effects are bad, can it be withdrawn? So that's my understanding, Chair. I might be wrong, but that's the only MDR in this field that I am aware of. I'll therefore request that I hand over to Dr. Motisenyane to deal with all the difficult questions, specifically from Honorable Wilson, on the membership, will the membership be equal? And then also expand on the issues of Article 8, if it will be hiding corruption, and then also on punitive measures of people who are not heeding to some of the areas of the treaty. Will there be an opt-out clause for South Africa should we not be happy? Also, the issue on financial resources that Honorable Gela raised. If you can deal with all of those, Dr. Motisenyane, over to you.
Thank you very much, DG. Let me start with the first one regarding the issue of the financial implications. As indicated, the sources for financial implication will come from member states' contribution, industry fees, and from development partners. I must indicate to the honorable members that the conference of the parties is its infancy stage. No decisions has been made with respect to the issues of member state contribution. And also there's not been discussions around whether there's going to be a particular formula that is going to be used in terms of this contribution, and whether it's going to be voluntary or whether it's going to be mandatory. So that decision has not been made. However, we need to make it very clear that if we have to develop an Africa-led African institution, which is going to get its funding mainly from private sector or even development partners, then there's going to be a problem in terms of there's going to be conflict of interest. Hence, it's very important that that member states have to be able, as the conference of the parties do, address the issues of the funding of our agency to deal with the issues of conflict of interest. So a decision has not been made. Regarding Article 8 in terms of privileges and immunities, this one, as you can see from the legal advice, it's only, it was in the context where we have decided to host AMA in South Africa. And these are the immunities and privileges to AMA, its members, its international personnel, its premises, its properties and assets as provided for in the South African legislation. So we are going to put a reservation around that. However, AMA, as I've already indicated, is going to be hosted by Rwanda. However, we are still going to make that particular reservations in that regard. With regard to the issue of what is it for South Africa on this, maybe let me go back to these three issues. One is that our interest, South African interest by ratifying the treaty, is to ensure standards are adhered to make sure that if we have standards that AMA has actually piggyback on South African standards, then we know that South African exports within the African market will be able to get into market. The second one is about opening continental market of a value around 1.2 billion. So South African products and services will actually get into that one. The third one, it's about reducing the timeline for the registration of medicines, because the process for registration of medicines in different countries takes a long time. So AMA will be able to have a database of specific medicines that have been already being registered, so that there's no need for duplication. And the last one is the whole issue around increasing economic integration within the African Union. And the issue of AMA, once more again, also is in line with our South African foreign policy objectives, which is biased towards Africa in terms of issues of development, where already some of the things that AMA is doing, SAPRA is already doing them in terms of joint assessment and inspection, regulatory harmonization, and so forth. The second one is the issues of economic development to make sure that South African exports can penetrate the African market. With regard to the issue that have been indicated about issue of corruptions and so forth, that will be dealt with by the organs of AMA. I've indicated that at the highest decision-making level, led by the ministers, is the Conference of Parties. Then below that, we have a board. Below there, we have a secretariat that will be led by the DG. And then below that, we have various technical committees. And indeed, when the Conference of Parties meets, a number of documents are going to be presented, firstly to the board, and secondly to a Conference of Parties, including the issues that honorable ministers, honorable members have indicated in terms of the issues that have indicated that we need to be able to do that. But more than anything, it's about ensuring that there is integration of medicines regulations, given the fact that there's globalization has led to a movement of goods, people, and services. With regard to the issues of FDA and WHO, I think we should be supporting the AMA simply because for the first time, Africa will have an African Medicines Agency, and it will have a voice in terms of African medicines regulatory issues, working as a network with other regional economic communities, but also national medicines regulatory authorities. And for the first time, Africa will have that. EU has its own European agency, so Africa will have that. And really, this is coming at the right time to make sure that that Africa speaks actually with one voice. But more than anything, the issues around the private sector, outsourcing and conflict of interest, really, those issues are the issues that are going to be managed by the organs of AMA, as I've indicated, the Conference of the Parties, the board, and secretariats. Hence, it's very important that South Africa quickly becomes a member, ratify the treaty, so that as we have these kind of discussions around the issues that honorable members have highlighted, we are also part of those kind of deliberations. And I must say, also indicated that through SAPRA, the CEO of SAPRA, we are already participating in some of the African harmonization technical committees. We are chairing some of those structures. However, when AMA discussions are being held, we don't participate in those meetings. And I must indicate once more again for the last time that South Africa is being expected to lead because we have done a lot in terms of medicines harmonization. Thank you, Chairperson.
Thanks, Dr. Motisenyane. I'll hand back to the Deputy Minister.
Yeah, that's all that we were presenting, Honorable Chairperson. Maybe back to you now, and we will be guided by you further. Thanks, but we completed on our side. Thanks.
Thank you. I just see the hand of Honorable Wilson. I noted that Honorable Clark has requested Honorable Wilson to raise any questions which he might have. Honorable Wilson.
Thank you, Chairperson. And yeah, more questions of clarity at this point. So one of the things, and I'm not sure if I've missed it, but I can't find it in the treaty, and I haven't got it in the responses either. Will the AMA have health targets that member states have to reach, like the UN does? I think that's quite important. And obviously a serious concern on the cost. We don't want to find ourselves in a situation where SA or South Africa is essentially dragging the whole AMA on its own, with other countries not pulling their weight. And the fact that there is no cost is concerning here. It's been one of our arguments in the NHI bill. Until such time as we know what we're dealing with, where that money is going to come from and how it is going to affect budgets either from a national, well, principally from a national issue point of view, or, you know, if this has got to come out of the health budget. If it is going to cost the South African fiscus in any way, we need to know how much it's going to cost. It's very easy to pass us, ask us to pass a treaty. But like everything else, you can't pass something that you can't deliver on. And our fiscus is very, very strained at the moment, and it's very, very concerning. And the fact that there's no costing or no idea of what this is going to cost us is quite concerning. I mean, we support the coordination and strengthening of ongoing initiatives, regulatory oversight, pooling expertise, etc. But at what cost? And to what point will it actually benefit us? It sounds like we're doing the major contributions at the moment through SAPRA, and our Medical Research Council is held in very high esteem. But if there's a cost involved that's going to affect the South African economy or the South African fiscus as it stands at the moment, we're going to have an issue. And again, I've been waiting for it and I haven't heard it. So with regards to Article 8, what were the concerns in the legal opinions and how are we going to address these? Thank you, Chair.
Thank you, Honorable Kaba.
Thank you, Chair. Chair, just to indicate that I think the department had been explicit in outlining and explaining wherein we may be having questions, but also safe to say, Chair, that the process of Parliament require our cooperation, and indeed also to note the fact that as the department, we may have had the work on the NHI on us, but also understanding that we still have other additional work, which is this part of it, what is happening here. So, Chair, I'm rising to indicate once more again my support that we adopt AMA and we proceed taking it to Parliament so that we are involved in African work for good medicine. Thank you, Chair.
Thank you, Honorable Gero.
Thanks, Chair. Again, Chairperson, I think I'm covered by Honorable Kaba. Indeed, we have other work that we must do as Parliament, and this is one of the work that we must do as a Parliament. So I fully arise to support AMA and also to support the input of Honorable Kaba, Chairperson. Thank you.
Thank you, honorable members. You'd remember that we had actually, when SAPRA raised that, we spoke about support for the AMA treaty. But this is not the moment for us to say that we need to take it to the House. We have processes in Parliament and we need to follow those processes very clearly. I said in the beginning that after we had received the presentation and had deliberations, a report will be written. That report will come to the Portfolio Committee on Health. It is there that we do adoptions of anything. Please, honorable members, let us follow the processes as outlined for us in the parliamentary rules, roles, and responsibilities. So we will come to that process of adoption. I would actually support what Honorable Wilson had just asked in terms of the cost. I think it's a very important point, very valid point, and I'm going to make a ruling that we get an indication, even if it's just a suggestion of how costs in terms of the establishment or participation of countries to the treaty, that we should get some indication. If not today, then within the next week from the department. so that at least when we do have a discussion on the adoption of the report, which, and just to mention, I fully support, and it has been raised by a majority of members at a previous meeting, that we support the AMA Treaty. It's already been indicated by the members of the Portfolio Committee on Health, an overwhelming majority. But I think it's a very important point. I'm going to allow just a minute for either the DM or for the DG to give an indication on this question of cost. And then, honorable members, there is something that I would like to raise as the chairperson of the Portfolio Committee with the DM and the DG before they leave our platform. Thank you. DM or DG.
Thank you very much, Honorable Chair. I'm now in another space where there's a challenge of load shedding, but if I can switch off my camera. We are a member of WHO, World Health Organization. At a particular time, we look into what is the value add to remain a member thereof. And we do see the guidance, support, and all that. I would imagine we are looking into the same issue with AMA. However, I also won't be able to technically know how much is our contribution to the World Health Organization, whether they're looking at us as a middle-income country, low middle-income country, advancing that. I would hope this June meeting of AU heads of state might talk to those issues, and therefore assist whether we should or should not be paying so much. But you are correct. If we then do have additional information while you are deliberating on this, that you can forward it to you, Dr. Motisenyane may bring. But maybe if there has not been any decision taken as to what will be the contribution fee, we will not be able to provide you that. But we hope that is not going to hold you back to make a decision in principle of supporting this, and still argue our point there to say maybe this finding could be this. But I don't think the contribution will actually be a killer contribution in light of what will be the contribution and the value add of Africa to be able to stand on its own feet on regulations and also on efficacies and the safety of medicines that we are going to use in the country. Maybe the DG might add on that. We don't have it yet now, but if we are pushed to looking for it, we will then ask those technically in the structure to send it to us. Thanks, Chair.
Thank you very much. I think the Deputy Minister, you have covered it, but we will because we've not been told. Actually, the decision has not been made on the formula to be used. But what we can just probably do is just to advise how much is it costing South Africa to be a member of the WHO, which we know because we pay the subscription fee. On the issue of Article 8, Honorable Chair, when that was raised by the state law advisors, we are still not sure who will be hosting the actual secretariat and everything. So it's going to be, now we all know it's Rwanda. So it's mainly, it's going to be issue because now it's people, those people who work for the AMA will be based there and all of that. So Rwanda will be taking care of those issues. So for us now, we should not be worried much because we're not going to be hosting them. So it should not be affecting us that much. But I'll allow Dr. Motisenyane just a second, just to add on that, and then we'll hand back to the Deputy Minister.
Thank you very much, DG. Indeed, DG, you are absolutely correct. Now that we are not hosting, we have not shown our interest to host the AMA in South Africa. The issues of immunities and privileges won't be relevant in terms of South Africa. But thank you very much, DG.
Thank you. Over to you, Deputy Minister. We're done on our side.
No, thanks. We are finished, Honorable Chair. We are done. We are bringing it back to you. Thank you very much, Chair.
Thank you very much. But do remember what I just indicated, DG, please write to us. I'm looking forward to that writing so that you get at least given an indication of where you are, whether you don't have any answer, that can also be the answer. But so that when we do deliberate, we'll be able to answer, maybe have an understanding of where we stand in terms of the cost for the participation in the ARMA board or agency itself, maybe, yeah, I should just say agency. But Deputy Minister and DG, I have a concern I want to raise with you today. And I have to raise this as the chairperson of the Portfolio Committee on Health. It is the fact that the department does not communicate with us on very important national and international events. Even with the Presidential Health Summit, there was a bit of a challenge for us to be invited. Secondly, with the Maternal and Child Health Care Conference, which had taken place in Cape Town. Thirdly, we believe there is an AIDS conference between the 20th and the 23rd of June. There is a SADC meeting currently sitting in Lusaka on TV. There is a global tobacco conference between 20 and 25th of November in Panama City. There's another meeting sitting at the moment of the Board of Healthcare Funders, etc. And then there is also this World Health Assembly between the 20th and 30th of May. Now, I think what I'm asking from you, Deputy Minister and DG, is that you commit to this portfolio committee of sending us and informing us. It's a decision which we need to take ourselves, whether we participate or not. But at least that we are aware, and it's also a very good stage for members of the Portfolio Committee to learn, to acquire knowledge, which will improve their participation in the particular work which is set before us. So I am really hoping that we'll get that cooperation for what I'm requesting from yourselves. So I'll hand back to you, Deputy Minister, and to DG.
Thank you very much, Chairperson. And I'm sorry that you had to raise it at this level. It is a very reasonable request. I will take it as just an instruction and a request to us to say we are part of oversight of health in the country. If there are activities in the country, outside the country, that has to do with health, even to indicate and remind us that it is an International Nurses Day on this day of the 12th of May. The minister is invited to the World Health Assembly next week. There is this issue that is taking place in this process. We need to give you that space and advance. So I want to commit, Chairperson, that between myself and DG, we will formally see those at least monthly or 2 monthly coming into your space. You may decide which one you would want, then a formal invitation for that to happen, but to give you a calendar of activities that we as a department are going to be part of, and which ones should you be encouraging us to formally send you an invitation. We should not find it difficult to do so. I am very sorry there's been an oversight on that part, and we commit with DG that we will do as requested by our chairperson on behalf of the Portfolio Committee. Thank you very much, Chairperson. Over back to you.
Thank you very much, Dr. Dlomo, Deputy Minister. Honorable members, that brings us to the end of our meeting. This meeting was called specifically for the purpose of what we have just discussed. Just a reminder of things in the future. It's going to be very short. On the 24th of May, we will be receiving the printed A list and the printed B bill of the National Health Insurance. And we've already been in discussions and looked at the first printed version. We're busy with the second one. After corrections, we'll probably have a third one before we bring it to the Portfolio Committee next week. And just a reminder of the outstanding work. This is one of the tasks which we had. The other task would be I'm trying to do a relaunch of the National TB Caucus, which is will require all of your assistance, and that will be brought to you. But also that after this, we then start with, we have applied for participation at or attendance at the AIDS conference, as I mentioned, 20th to the 23rd of June. We have also applied for an oversight visit to Eastern Cape between the 2nd and 4th of May, which is our follow-up meeting, that follow-up oversight that we had promised. We are looking at getting the department to come and present on the Tobacco Control and Electronic Services Delivery Bill. And then we are hoping to embark on provincial public hearings. I'm not certain exactly of the date, but I think it's the 8th and 9th we start, or the week after, but we will be in communication with you on the exact dates. Be mindful that we'd have to go to the provinces. We have a challenge with constituency period, which will be very long. We would have to apply for special leave to be able to do that work in terms of the public hearings. We must also be reminded that after we have received the presentation from the National Department of Health, that we'd have to have a period of a month for advertisements, for submissions. And so that's a very long process we still need to start with and follow through, honorable members. And we would hope, since it's not, I don't anticipate it being as difficult a bill as the National Health Insurance Bill, that we'll be able to complete that work before we have elections next year. So we all need to work very hard on trying to participate, but also it might be that we pack the program very full. Thank you very much, honorable members. I will now, if there's any clarity on what I just raised, I think I'll give an opportunity on the programs going forward, only on the dates and programs. If none, it was for you to note, and thank you very much for participating. Minister, Deputy Minister, maybe a last word from you, and then we will close our meeting.
Yeah, no, thanks, Chair. Thanks for your engagement and your accepting and then giving us opportunity to present. We don't have any further comments. Thank you very much, and the whole portfolio committee for the support that they've given and guidance that they always give to us. Thank you very much, Chair.
Thank you. That brings our meeting to a close. Enjoy the rest of your day. Thank you. Bye.
Thank you.
Thank you, Chair. Bye.
Thank you,
Recording
Chair.
stopped.